What is an antihistamine? A drug that reduces or eliminates the effects mediated by the chemical histamine. Histamine is released by our body during an allergic reaction and act on specific histamine receptors. The term antihistamine refers to H1 receptor antagonist, actually inverse agonist, which means antagonists are inverse of agonist. Antihistamine compete with histamine for binding sites at the receptors. Antihistamine cannot remove the histamine if it is already bound. Histamine was first identified in 1910 and recognized in 1920 as a major pathogenic mediator of the allergic disorder. Histamine receptors antagonist was introduced in 1937, and from 1942 to 1981 more than 40 compounds have reached the market. Histamine is derived from decarboxylation of amino acid histidine, a reaction catalyzed by enzyme L-histidine decarboxylase. It is an endogenous substance synthesized and stored in and released by mast cells which are abundant in the skin, GI, and respiratory tracts, and also in the basophils in the blood. Allergies are caused by hypersensitivity reaction involving antibody class IgE, which are located on the mast cells in the tissues and basophils in the blood. When allergen is encountered, it binds to IgE, which activates the mast cells or basophil, leading to release massive amounts of histamine. Now this picture shows how allergen induced histamine release. First, you can see mast cells and Ig receptors, and then the attachment and degranulation effects. The different histamine receptors. There are 4 kinds of receptors: H1, H2, H3 and H4. H1 are present throughout the body, specifically in the smooth muscles, on vascular endothelial cells, in the heart or in the CNS. H2 in more specific locations in the body, mainly in the gastric parietal cells. A low level can be found in vascular smooth muscles, neutrophils, CNS, heart and uterus. H3 mostly found in the CNS with high level in the thalamus, caudate nucleus and cortex. Also a low level detected in the small intestine, testes and prostate. H4 discovered in 2000. They are widely expressed components in immune system such as spleen, thymus and leukocytes. Pharmacological effects of histamine. Histamine promotes smooth muscle contraction, which is an H1 receptor mediated effect. Histamine increases gastric acid and gastric pepsin secretion, which is H2 receptor mediated effect, and vasodilation of arterioles and precapillary sphincters, which is H1 and H2 mediated effect. Now, clinical symptoms associated with histamine release. Mild symptoms are erythema, urticaria or itching. Mild to moderate are tachycardia, skin reactions, dysrhythmias, moderate hypotension, mild respiratory distress, and severe symptoms include severe hypotension, ventricular fibrillation, cardiac arrest, bronchospasm, and respiratory arrest. Clinical classification of H1 antihistamine. Highly sedative includes diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. Moderately sedative includes phenyramine, cinnarizine, cyproheptadine, and mild sedative includes cyclizine and chlorpheniramine.